If you are a mature gentleman who continues to engage in self-pleasure, it is important for you to pay attention to this. There's a crucial insight that often goes unspoken. In reality, it could be the subtle factor contributing to diminished erections, reduced sensitivity, and a decline in your confidence. It's not merely the action itself, but rather the manner in which it is executed that holds significance. I am Dr. Olivia Carson. For the last 3 decades, I have dedicated my efforts to assisting men over 60 in regaining their vitality, connection, and power. This is one of the most prevalent, yet often misunderstood concerns I encounter regularly in my practice. Many individuals perceive masturbation in absolute terms, viewing it as either entirely beneficial or wholly detrimental. However, the reality is more intricate and significantly more crucial than you realize. While self-pleasure can contribute positively to your well-being, it may also gradually undermine your performance, hormonal balance, circulation, and even your relationships with others if approached incorrectly. In this video, I will guide you through the 10 overlooked risks of masturbation after the age of 60 that many healthcare professionals fail to discuss. Discover how to transform this personal practice into a beneficial strategy that safeguards your prostate, boosts circulation, elevates testosterone levels, and enriches your intimate experiences. Before we conclude, I will share a natural technique that takes just 7 seconds, which I recommend to my patients to aid in restoring firmness and enhancing drive. Effectively, confidently, and without the need for medication. Let's get started, as your well-being and self-assurance warrant honesty. Before we begin, if you haven't subscribed yet, please take a moment to click that button and activate the notification bell to ensure you never miss crucial health information tailored for men in their 60s and beyond. If this video resonates with you, please type 1 in the comments. If not, please enter 0. Your feedback is important to me, and it guides me in producing content that genuinely meets your needs. Now let's discuss the aspect that often catches many men off guard. The risks extend beyond the physical realm. They originate from a much deeper place. The initial concealed danger of masturbation after the age of 60 is one that I've observed quietly undermine the emotional health of numerous men. And yet, there seems to be a lack of warnings regarding it. It's not solely about your physique. Your relationship with the surrounding environment is essential. Risk number 1. I recall a moment spent with a patient of mine discussing the challenges of social isolation. He is a 67-year-old retired educator from the high school system. He possessed a subtle gaze, one that carried a weight not attributed to age, but rather to the experience of being overlooked. After a brief exchange of pleasantries, he leaned in and said, "Doc, I haven't been intimate with anyone in months, but I still manage my own needs. Is that a concern?" That inquiry lingered in my mind, not due to the action itself. Self-pleasure is a natural and normal aspect of human sexuality. Indeed, when approached with purpose and equilibrium, it can contribute positively to a man's sexual well-being. The issue arises when it serves as a substitute for genuine intimacy instead of enhancing it. Numerous men in their 60s, 70s, and even 80s often find themselves settling into subdued, daily patterns. A solo release transforms into a source of solace, a routine, a means to experience a sensation, if only for a brief period. Gradually, often without awareness, individuals cease to pursue connections with others. In terms of emotional connections, romantic relationships, and social interactions, masturbation serves as a means to address certain needs. until the divide transforms into a vast chasm. It's more than merely physical intimacy. It concerns the delicate, distressing detachment from existence, from embraces, from joy, from meaningful glances, from the experience of being acknowledged as an individual, not merely a client or an elder. I've observed that many men have withdrawn from dating, physical intimacy, and meaningful interactions, as the convenience of self-satisfaction often outweighs the challenges of forming genuine connections. And here's the reality that many hesitate to express openly. Physical touch transcends mere pleasure. It's a field of healthcare. It's what maintains your emotional vitality, stimulates your testosterone levels, and sustains your self-esteem. When you cease to connect, your universe begins to contract. It's not about aging, it's about the belief that your contributions are still valued and desired by others. If you've observed yourself becoming increasingly introspective, if your intimate life has turned into your sole avenue for connection, that shouldn't be seen as a shortcoming. It serves as an indication, just a gentle nudge that you have the potential for greater things, and that further possibilities remain, regardless of the time that has passed. Re-establishing that bond doesn't necessarily require diving back into the dating scene or pursuing romantic interests. Often, it begins with a simple act like reaching out to an old acquaintance, participating in a community organization, or initiating a dialogue with a stranger. Intimacy extends beyond mere physical connection. It's about recognition, understanding, and embracing our humanity once more. The instant we cease to believe we are worthy of intimacy is the instant we begin to accept solitude masquerading as self-sufficiency. While emotional distance poses a subtle threat, the subsequent concern is more intimately connected to the physical aspect of health. Many men remain unaware of the harm they are causing until it is far too late. Allow me to explain what it is and how you can prevent it. Second risk. Recently, a patient in his early 70s approached me with a concern that he found quite difficult to bring up. He mentioned, "Doc, I've been experiencing some irritation in that area after you're aware. It has been occurring with increasing frequency recently." His voice revealed a genuine concern, tinged with a hint of shame, as if he believed this was an issue he should have outgrown by now. The reality is clear. The penile skin, particularly with advancing age, tends to become more fragile, thinner, and exhibits a reduced healing capacity. The body experiences a decline in collagen and elasticity that is characteristic of younger years. When you consider years of friction, it's understandable that numerous older men experience what we refer to as micro-lesions. Minor injuries or scratches on the skin can occur during masturbation, particularly if it is performed too forcefully or without adequate lubrication. Initially, many men may not even be aware of it. A bit of redness, a gentle sting afterward, perhaps some slight sensitivity for a few hours. However, with time, these ongoing micro-injuries may lead to inflammation, irritation, and potentially scarring. They can exacerbate sensitivity rather than improve it. In certain instances, they can create an opportunity for infections, whether bacterial or fungal, that flourish in warm, humid conditions. The most challenging aspect: numerous men believe that discomfort indicates an issue with their hormones or nerves, when in fact, it often simply requires a refinement in their technique. Masturbation should not be painful, and experiencing discomfort does not indicate that there is something wrong with you. Your approach must adapt to the changes in your body. What options are available to you? Initially, approach with care. You've moved beyond your 20s, and that should not be seen as a deficiency. It's essential to prioritize your body's health and well-being. Secondly, it is essential to utilize a high-quality water-based lubricant. Avoid using petroleum jelly, not saliva. An appropriate lubricant minimizes friction, prevents tearing, and can help maintain sensitivity over time. Take your time. There's no need to rush. This focuses on the importance of connection rather than merely achieving a sense of completion. I frequently remind my patients that this phase of life is not about diminishing enjoyment, it's about enhancing satisfaction. Enhanced satisfaction, a perspective that values the body and acknowledges the experiences that have shaped it over time. There is no reason to feel embarrassed about modifying your self-exploration techniques. Indeed, it holds significant strength. You're discovering how to collaborate with your body rather than opposing it. And that's the true essence of masculinity at this stage of life. Understanding, not evasion. Now, if friction and irritation are sensations that signal potential issues, what about the risks that remain undetectable? What if I revealed a concealed danger that impacts not your skin, but your cognitive function? One that quietly conditions your body to cease reacting to genuine intimacy entirely? That is the focus of our upcoming exploration, and I assure you, it could transform your entire perspective on pleasure. Risk number 3 involves desensitization. At 64, he was sharp-minded and healthy, still engaged in part-time work, yet he sat in my office with an air of defeat. He expressed, "Doc, I no longer experience sensations the way I once did. I can manage it independently, but when it comes to my wife, the situation changes. I am uncertain about what might be affecting my well-being." This is a common occurrence that may surprise you. It's important to recognize that the issues at hand aren't solely related to low testosterone levels or circulation problems. At times, it pertains to what I refer to as the subtle conditioning of the nervous system. When a male engages in repetitive self-stimulation with the same grip, rhythm, pressure, and fantasy or visual aid, the brain and body start to link pleasure exclusively to that particular pattern. It's akin to creating a profound channel in the earth. Whenever you pour water, it consistently adheres to a specific trajectory. Eventually, it loses the ability to navigate to other destinations. In the context of sexual health, this phenomenon is referred to as desensitization. For men in their 60s, this can manifest as challenges in experiencing arousal with a partner, requiring heightened stimulation to achieve the same outcomes, or finding it difficult to reach climax without replicating a particular solo setting. What used to come easily now seems like a chore, leading to feelings of confusion, frustration, and even shame. However, it should not be viewed as a moral shortcoming. It doesn't even pertain to a medical context. It involves the processes of neurological conditioning. And the positive aspect is, it can be reversed. Begin by altering your approach to self-exploration. Adjust the pace. Adjust your hold. Investigate various postures. Consider tapping into your creativity instead of depending on outside influences constantly. And above all, take your time. Take your time before reaching a conclusion. Allow yourself to discover. By introducing diversity and excitement, you can revive sensitivity. It's not solely a physical matter. It also involves the mind. And here's something I share with every individual facing this challenge. Your nervous system is functioning as it should. It has simply been excessively conditioned in a singular manner. What it requires is not embarrassment. It requires understanding, consent, and a period for adjustment. I've observed individuals rekindle their relationships with their partners after prolonged periods of disconnection merely by adopting new practices. They were able to achieve results without the use of medications or interventions. They required the freedom to investigate their own experiences with a sense of wonder rather than haste. This risk is nuanced, and that is what renders it perilous, because you may not even recognize it is occurring until the gap between you and your partner seems insurmountable. However, the bridge can indeed be reconstructed. It begins with reshaping your reactions to pleasure, whether experienced individually or in partnership with another. Now, if desensitization alters your body's experience of pleasure, the subsequent risk is even more concerning because it may conceal a serious health risk. It's the aspect that many men tend to ignore. It frequently remains unnoticed until the situation has progressed significantly. Let's discuss this matter further. What remains unknown in this context can indeed manifest. Fourth risk: concealing erectile dysfunction. A gentleman in his late 60s finally decided to seek my expertise after delaying for nearly a year. He appeared fit, exercised regularly, had a long-standing marriage, yet there was an underlying concern troubling him. After some gentle conversation, he finally admitted, "I can achieve an erection when I'm alone, doctor. However, with my partner, it simply doesn't occur. I have ceased my efforts." The weight of that moment was profound, not due to any inherent flaw, but rather because he was unaware that his body was signaling a crucial alert. What he perceived as a slight intimacy concern was, in fact, an initial indication of a more profound underlying issue. Potential issues related to vascular health, glucose regulation, or hormonal levels. Here's what many men may not be aware of. Medical professionals may not always provide thorough explanations. The penis serves as an indicator of your cardiovascular health. As circulation diminishes, arterial elasticity decreases, hormonal levels decline, or nerve sensitivity wanes, the capacity to achieve and maintain an erection with a partner frequently becomes the initial aspect to be affected. However, due to the relative ease of masturbation on mental, emotional, and physical levels, many men tend to believe that there are no underlying issues. They continue to operate but are not fully present. However, that presumption can pose significant risks. Masturbation may occasionally overlook more profound concerns. It does not involve the same level of psychological or physiological intricacy. While you might be able to maintain arousal on your own, it's important to recognize that early signs of erectile dysfunction could indicate underlying issues such as heart disease, diabetes, or low testosterone levels. These conditions are often highly treatable if addressed promptly. It's always preferable for individuals to seek my expertise regarding their concerns sooner rather than later, rather than waiting for more serious issues to arise. Timely intervention allows us to enhance circulation, restore hormonal balance, and potentially reverse numerous causes of erectile dysfunction without resorting to aggressive medications or surgical procedures. And here's a message I want to share with every man over 60. Seeking assistance is a sign of strength, not weakness. What poses a risk is procrastination. What poses a danger is the absence of communication. Observing a trend where erections are less firm, shorter in duration, or only occur during solo activities while fading in the presence of a partner is significant and warrants attention. That's an important aspect to consider with a reliable medical professional who views you as a complete individual rather than merely a set of symptoms. You deserve a complete and fulfilling life, not just temporary solutions. Relying on solitary habits merely postpones the healing process that you are entirely capable of achieving. Now, if this risk resides within your blood flow and hormones, the next one emerges from something even more unexpected, something as straightforward as your sitting posture. It may come as a surprise, but the position you find yourself in could be subtly harming a crucial nerve that influences pleasure, sensation, and the overall health of your pelvic region. Allow me to guide you in preventing this issue. Risk number 5, nerve compression resulting from inadequate posture. A few years back, I encountered a gentleman in his early 70s. The patient presented with a complaint of a dull, persistent numbness in the groin area, which has progressively worsened over the last 6 months. He suspected it could be related to circulation, or perhaps the inevitable effects of aging were finally manifesting. However, following a comprehensive assessment, I concluded that it was not vascular in nature. It was related to the nervous system, the underlying issue. There was an intriguing complexity in the way he was positioned. Many individuals are unaware that posture, particularly while engaging in self-pleasure, significantly impacts nerve health. Numerous older men find themselves spending extended periods in seated positions, whether in recliners, office chairs, or in a more private, hunched posture. Although it may appear innocuous, the strain from sitting on rigid surfaces or adopting a slouched posture can gradually compress the pudendal nerve, which is crucial for sensation in the penis, perineum, and the surrounding pelvic region. Over time, that compression may result in numbness, tingling, diminished sensitivity, and potentially pain during or following sexual activity. It frequently begins in a nuanced manner. Perhaps you notice a decrease in responsiveness or experience an unusual tingling sensation. However, if this issue is not properly managed, it may develop into a chronic condition that becomes increasingly difficult to reverse. It's quite exasperating, as many men believe the issue stems from hormonal factors or their libido, when in reality, it often boils down to a mechanical concern. However, the positive aspect is that once you grasp the concept, rectifying it becomes straightforward. Understanding is the first step towards finding a solution. Refrain from engaging in masturbation while seated on rigid surfaces or adopting a forward slouched posture. Opt for a reclined or lying down position that provides proper support for your spine and pelvis. Placing a pillow beneath your knees can alleviate pressure on the lower back and facilitate the opening of the pelvic region. Additionally, ensure you incorporate regular breaks from prolonged sitting during your day. Rise, extend your limbs, and encourage circulation. Movement is essential for your nervous system, just like it is for your muscles. I consistently remind my patients that comfort is not merely a luxury. It serves as a safeguard. Your body positioning during intimate moments can significantly reflect your approach to long-term wellness. Allowing your nerves the space they need enables your body to reconnect with its sensations. While it might appear insignificant, these minor habits accumulate over time. When you experience a sense of numbness in areas that once brought you vitality, it transcends the physical realm. It resonates with your sense of manhood, your self-assurance, your relationship with your own identity. While posture can subtly influence sensation, the next risk delves into an even more nuanced area, one that many individuals may resort to during times of stress, loneliness, or boredom. What may initially appear benign or even beneficial can gradually evolve into an insidious emotional snare. Let's discuss the implications when self-pleasure transitions from a physical act to your sole means of finding relief. Risk number 6, relying on it as your sole emotional release. A gentleman in his late 60s once shared with me, almost casually, that there are days when he simply grows weary of experiencing emotions. Engaging in self-pleasure allows me to find relief and relaxation. He wasn't referring to desire. He was discussing feelings of isolation, the weight of anxiety, the monotony of life, and that persistent discomfort in the chest that intensifies when there are no calls, no check-ins, and the days begin to blur together. And I comprehended his perspective, as for numerous men over 60, particularly those who are retired, widowed, or living independently, masturbation evolves into something beyond mere physical release. It serves as a form of release, a method to manage emotions that seem too burdensome to bear. Your pursuit isn't truly about seeking pleasure, you're seeking comfort. You're attempting to silence the distractions. Indeed, engaging in self-pleasure can serve as a temporary means to alleviate stress by decreasing cortisol levels. This process generates a short-lived mix of dopamine, oxytocin, and prolactin, which are hormones that contribute to feelings of calmness, safety, and affection. However, when it serves as the sole emotional outlet, it may gradually evolve into a means of evasion. Rather than confronting the underlying emotions such as sadness, grief, frustration, or restlessness, you choose to dull them through sensory experiences. What begins as a means to manage stress can subtly evolve into a reliance. It may go unnoticed until you find yourself declining social invitations, steering clear of phone conversations, or losing passion for activities you once enjoyed, all in the name of seeking that fleeting feeling of control by staying in. I wish to express my thoughts clearly. Seeking comfort is a natural and human experience. Every individual, irrespective of their age, requires effective strategies to manage emotional stress. However, if masturbation is your sole method of coping, it might be beneficial to broaden your emotional strategies. Begin with gradual progress. Engage in a conversation with another individual, a companion, a guide, or perhaps a community of support. Engage in physical activity. Embrace the outdoors. Develop new practices that incorporate social interactions beyond mere isolation. Discover fresh patterns that invigorate your sense of vitality, rather than merely diverting your attention. While the pleasure of orgasm is undeniable, it cannot replace the significance of purpose, meaningful dialogue, or the bond with something greater than oneself. You deserve a life that offers lasting fulfillment beyond temporary comfort. Emotional resilience is essential for your well-being. True strength is derived from variety, the capacity to experience emotions deeply and react thoughtfully rather than automatically. That level of awareness embodies a profound sense of masculinity. While emotional escape may subtly deplete your spirit, the subsequent risk can quietly burden your physical well-being. It's an occurrence that catches many men off guard, until they begin to experience a persistent sensation of heaviness in the groin area. Let's discuss the implications of excess in certain areas and how to restore harmony within your body. Seventh risk: feelings of guilt or shame. He was 72 years old and had retired from his role as a pastor, gentle and reflective. As we initiated the conversation regarding his sexual health, I noticed his gaze fell to the ground. His voice became softer. Then he expressed a thought that will remain etched in my memory. "Doctor, I still engage in that behavior occasionally. Afterward, I sense that I may have made an error. I find it difficult to face my own reflection." The kind of silent embarrassment often goes much deeper than many men understand. It's not solely about your actions. It revolves around the beliefs instilled in you regarding the matter. For numerous men from the older generation, particularly those brought up in profoundly religious or conventional environments, the act of masturbation was perceived not as a personal form of self-care, but rather as something sinful, weak, or deviant. The echoes of those messages linger well beyond the moment they cease to be heard. Even after all these years, I still encounter men who bear the weight of guilt as if it were an inseparable part of them. Individuals often refrain from discussing these matters with their peers, seldom raise them in consultations with healthcare professionals, and rarely reflect on the legitimacy of the guilt they may feel. Instead, it deteriorates. Each instance of self-exploration brings a fleeting sense of relief, only to be succeeded by prolonged periods of inner turmoil. Not due to physical pain, but because it damages their self-perception. Listen closely to what I have to say. Caring for your own body is a natural and important aspect of health and well-being. Seeking pleasure, comfort, or connection is a natural and acceptable desire. In this later stage of life, the pursuit of intimacy may become more challenging, yet it remains an essential aspect of well-being. Engaging in masturbation, approached with mindfulness and consideration, serves as a method of nurturing both your physical and emotional well-being. It's not a defect, it's not a setback, it's a natural aspect of being human. However, if you have harbored guilt for an extended period, even without expressing it, the repercussions can be significant. Persistent feelings of shame can elevate cortisol levels, disturb the nervous system, and reduce the body's ability to experience pleasure. It can diminish your self-assurance, obscure your connections, and lead you to feel undeserving of the fundamental experiences of life, intimacy, happiness, and connection. What is the initial step in the journey to recovery? It's not altering your actions, it's transforming your perceptions regarding it. At times, this involves engaging with a therapist, particularly one who specializes in sex-positive approaches or has experience with older adults. At times, it involves reshaping the narrative within your mind, substituting criticism with understanding, and transforming remorse into appreciation. You are not defective. You are not unclean. As a man, you possess unique needs, desires, and a narrative that is distinctly yours, and you have the right to embrace all of it without any sense of shame. And while guilt can burden your heart, the next risk we are about to delve into is one that imposes an even greater strain on your body. Absolutely. It's a subtle discomfort that gradually intensifies as time goes on. Many individuals fail to acknowledge the issue until the discomfort reaches an unbearable level. Let's discuss the signals your body sends when it requires rest. Risk number 8. Pelvic congestion syndrome. Recently, a gentleman in his late 60s approached me with an unusual concern. He expressed, "Doctor, I'm not quite sure how to articulate it precisely. However, there is a persistent, uncomfortable sensation in that area. Not precise, manageable. It's simply an unrelenting pressure. It seems that there may be an underlying issue." He had eliminated the possibility of infection, and the results of his prostate examination were normal. However, when I inquired about his habits, especially regarding the frequency of his ejaculations, his response provided me with all the insight I required. Following his retirement, he noted that his days became more tranquil, with increased time spent at home and a reduction in daily structure. In an effort to manage feelings of boredom and stress, he began to engage in self-stimulation. Not infrequently, but rather 2 and at times even 3 times daily. It assists me in getting a good night's rest, he mentioned. It provides me with a purpose. Recently, I've been experiencing some discomfort. What he was experiencing is a condition known as pelvic congestion, a collection of blood and increased pressure in the pelvic area, resulting from continuous, frequent stimulation without sufficient recovery periods. Frequent ejaculation, particularly when it occurs over a prolonged duration, can lead to irritation and inflammation of the tissues and blood vessels in the pelvic region. You may experience a sensation of heaviness in the testicular area, a profound discomfort behind the pubic bone, or even a persistent soreness that remains without clear explanation. This is not a matter of ethics. It's all about achieving equilibrium. As you age, your body requires adequate time for recovery. The mechanisms governing blood circulation, hormone secretion, and muscle contractions are now more intricate than they were at the age of 25. That doesn't imply you're weak. It signifies a deeper understanding. That insight allows for a deeper level of attentiveness. If you're noticing a persistent feeling of pelvic heaviness or a sense of fatigue and tension following frequent masturbation, it may be your body's signal for a need for balance, rhythm, and moderation. For optimal results, it is generally advisable for men over 60 to allow a few days between sessions, not due to any issues with excess, but rather because recuperation holds equal significance to engagement. Keep in mind that an increase doesn't necessarily equate to improvement. The enjoyment derived from an experience does not necessarily amplify with its recurrence. Indeed, allowing your body the necessary time to rejuvenate can lead to sensations that are often intensified, more vivid, and ultimately more satisfying. There's no need to endure that persistent discomfort. It's important to listen to your body and acknowledge any discomfort or subtle signals it may be sending you. Occasionally, a slight adjustment in timing can significantly impact your overall well-being in terms of physical, emotional, and sexual aspects. Pelvic congestion serves as a signal from your body, indicating an issue from below, while the next risk we will examine originates at the cellular level. And it is crucial if you are contemplating becoming a father. Indeed, it remains achievable even in your 60s or 70s. However, it's important to understand how this next habit may be subtly undermining your opportunities. Risk number 9, possible effects on semen quality. At 61, recently remarried, he entered my office radiating a sense of quiet excitement. My wife and I have been attempting to conceive, he shared. She is younger, and we remain optimistic. However, it has been 6 months, and there has been no progress. He remained calm, not at this time, yet I sensed the burden of his expectations. The expectations to fulfill it. Upon examining his laboratory results and lifestyle choices, everything appeared to be in good order. Optimal hormone levels. No significant health concerns detected. However, when I inquired about his ejaculation habits, he hesitated. Quite frequently, he mentioned daily and occasionally even more frequently. It aids in my relaxation. I thought that having more would be advantageous, wouldn't you agree? That's a widely held notion. However, regarding fertility, the situation is more complex than it appears. It is important to note that while frequent ejaculation is generally not detrimental for most men, it may lead to a temporary decrease in semen quality, especially in terms of sperm concentration. This indicates that while your body is generating sperm, it might not be allowing sufficient time for each sample to restore to optimal levels. For men in their 60s and beyond, the gradual decline in natural sperm production can be more significant than many might understand. It's important to clarify that frequent ejaculation does not necessarily harm your fertility. Absolutely not. However, when you and your partner are engaged in the journey of conception, the timing becomes crucial. Excellence is essential. Interestingly, practicing moderation can enhance your chances. Studies indicate that a period of abstinence lasting between 2 to 5 days prior to trying for conception generally leads to optimal sperm concentration and motility. It's essential to allow your body the necessary time to replenish its resources and perform at its optimal level. This is where understanding transforms into strength. Numerous older men retain the ability to father children effectively. Indeed, a significant number do. However, it is essential to comprehend how the body operates currently, rather than how it operated at the age of 25. Fertility involves more than mere aspiration. It involves understanding the biological factors, recognizing the importance of timing, and being deliberate in your lifestyle choices. If the desire to create life remains close to your heart, or if you wish to keep that possibility alive, it may be time to rethink your daily habits. There's no requirement for lifelong abstinence. Allow your body the necessary time to prepare, to regenerate, and to provide what is essential when the moment arrives. And keep in mind, your capacity to bring forth life extends beyond the physical realm. It evokes deep feelings, it's vibrant, it represents the enduring vigor that remains within you. While this risk pertains specifically to the goal of fatherhood, the final risk is one that impacts nearly every man, regardless of whether you are attempting to conceive. It may not manifest in your body immediately. The journey begins in your mind. And if one isn't cautious, it can alter perceptions of women, self-identity, and the fundamental essence of intimacy. Let's discuss this matter further. Risk number 10: separation from the tangible world. I once engaged in a conversation with a gentleman in his early 70s who expressed himself with striking candor. "It's not that I lack a desire for closeness with a partner," he expressed. "It seems that reality has lost its appeal for me lately. I am uncertain about the moment it occurred. I have lost my enthusiasm for genuine connection." That moment lingered in my mind, as what he was articulating went beyond erectile dysfunction or low testosterone. It was something more nuanced. In numerous respects, it can be even more harmful. He had unwittingly conditioned his mind to react solely to fantasy, to the carefully crafted allure of pornography, and as time passed, genuine experiences, touch, scent, voice, emotion, simply couldn't measure up. The human brain, particularly the male brain, exhibits a remarkable sensitivity to new experiences and stimulation. Repeated exposure to intensely stimulating and unrealistic material leads the brain to modify its reward mechanisms. It yearns for the utmost, the theatrical, the unattainable, and gradually it ceases to react to the organic, to the tender rhythm of authentic human interaction. For men in their 60s, this risk becomes particularly significant. As life decelerates and feelings of isolation emerge, the allure of retreating into a virtual realm can intensify. There is absolutely no judgment involved in that. Exclusively comprehension. Displays do not turn away. They do not necessitate openness. They provide a consistent level of stimulation. However, what they frequently take, often without your awareness, is your sensitivity, your presence, and your capacity to be profoundly affected by something genuine. What starts as a straightforward visual tool can develop into a reliance that complicates connections, affecting not only sexual intimacy, but also emotional bonds. One might experience a sense of disinterest in real-life situations that once sparked happiness. It's common to find yourself making comparisons between partners, often without even realizing it, to unrealistic images that were never genuine in the first place. However, there is some positive information to share. This type of disconnection can be reversed. Your brain is adaptable. This indicates that it is subject to change. It is possible to retrain it. Begin by stepping away from synthetic material. Substitute it with recollection, with creativity, and with genuine human interaction whenever feasible. Examine. Contemplate. Allow desire to develop naturally, without the pressure for immediate fulfillment. Allow yourself the opportunity to explore the profound and nuanced aspects of intimacy at a more measured pace. There's no need to confine yourself to a digital existence. It's never too late to experience genuine emotions once more. Often, the most profound stimulation arises not from visual stimuli, but from memories, emotions, and the anticipation of reliving past experiences. Having delved into these 10 concealed risks, physical, emotional, hormonal, neurological, there's one last aspect we must address. Understanding the risks is only part of the equation. Imagine a straightforward, natural method that takes only 7 seconds each day to potentially reverse significant damage, enhance blood circulation, and revive the energy you believed was gone for good. That is precisely what I aim to demonstrate to you next. In conclusion, you are now informed. Engaging in masturbation after the age of 60 can be viewed from various perspectives, neither strictly positive nor negative. It's not simply a matter of extremes. It serves as an instrument. Just as with any instrument, the manner in which you utilize it dictates whether it fortifies your well-being or gradually diminishes your vitality. We have discussed 10 genuine risks, including social isolation, desensitization, nerve damage, feelings of guilt, pelvic congestion, and even a disconnection from reality. These are not intended to instill fear. They are designed to stimulate your senses, to empower you with the knowledge and encouragement to prioritize your well-being. This phase of life is not about relinquishing anything. It's about approaching them from a different perspective, with greater purpose, enhanced attention, and deeper insight. Your body continues to react. Your aspirations remain significant. With some minor adjustments, your personal practices can transform into a source of empowerment rather than embarrassment. If this discussion resonates with you, then continue to engage with me. What I'm about to reveal may hold the potential to restore everything you believed was beyond reach. A straightforward, organic approach I've shared with countless individuals. One that could potentially transform how you feel by tomorrow morning. Let's discuss this matter further.